Hi everyone, and welcome to another episode of the Afya Health and Lifestyle Interview Series from the Agbari Multimedia Company. At Afya, we'll be inviting health specialists to educate you on the causes and prevention of certain diseases, shed light on some of the myths and misconceptions you must have heard about them, and also equip you with practicable tips to attaining good health. If you're a first-time viewer here, welcome to the Agbari channel, and we hope to see you around more often. And for returning viewers, it's great to have you here again. Please don't forget to subscribe, like, and share this video with your loved one because, as I always say, you don't know whose life the information here might be saving. On today's episode of the show, we're going to be talking about a dicey topic. It's sickle cell disease, but most of you might know it as SS. I think that's what most people around this side of the world know it as SS. So that's what we're going to be talking about. And we have the health specialist in the person of Dr. Ugochi Ogu to educate us on all the basics really. Before I add her to the stage, I would like us to meet her first. I'll just read a bio. So Dr. Ogu is an assistant professor of medicine at the University of Tennessee Health Science Center and the medical director of the Diggs Carls Comprehensive Sickle Cell Center. She obtained her medical degree at Windsor University School of Medicine in the West Indies, completed residency in pediatrics at the University of Iowa, and fellowship in pediatric hematology oncology at Memorial Sloan Kettering Cancer Center, that's New York, the Presbyterian Hospital, Weill Cornell Medicine. Following this, she joined faculty at Montreal Medical Center, also known as the Albert Einstein College of Medicine, as assistant professor of medicine and pediatrics and assistant director of the Sickle Cell Center for Adults. In August 2019, Dr. Ogu became faculty at UTHSC and joined Regional One Health as medical director of the Diggs Carls Comprehensive Sickle Cell Center. Our clinical interest focuses on sickle cell disease and transition of care from pediatrics to adults. Welcome to the show, Dr. Ugochi.
Thank you very much. Happy to be here.
Thank you. Would you like to say hi to our viewers?
Sure. Hello to all the viewers. I know we have people from different countries. You're welcome to this live session, and it's my pleasure to be here.
Thank you for that, Ma. So let's just get to it. So my first question is, mostly when you say sickle cell disease, most people around here say SS, like the genotype SS. I want you to help us shed more light on what sickle cell disease is.
Yes, so sickle cell disease is a genetic disorder of the blood. And genetic, that means it's passed through the genes. It can go from generation to generation. And it mostly affects the red blood cells. Now, what are blood cells? So there are three main blood cells that you have. You have the red blood cells, you have the white blood cells, and you have the platelets. The white blood cells are the part of the blood cells that help you fight infections. The platelets are the part of the blood cells that help you stop bleeding when you have a cut. And the red blood cells, which is affected in sickle cell, they help you carry oxygen. So they deliver oxygen to the body's tissues and organs. Now in sickle cell, it's a problem with the red blood cells. So normally the red blood cells are nice and round, donut shaped, but in sickle cell, they're misshapen. Instead of nice and round like donuts, they have a half moon or crescent or a sickle shape. And that's where the name sickle cell disease comes from. And this results in when you have periods of low oxygen, normally the normal red blood cells can deform themselves and go through the small holes in the blood vessels, in the small blood vessels. But with sickle cell disease, the red blood cells cannot do that as well. So when you have periods of low oxygen, they're not able to kind of squeeze into the red blood cells, the blood vessels, and get to the tissues. What happens is that they precipitate and form an aggregate that plugs up the blood vessels. And in this way, the tissues and the organs become starved of oxygen. And this leads to what we call crisis, vaso-occlusive crisis in sickle cell disease. Now, you talk about SS. So there are different genotypes or variants of sickle cell disease. SS is the most common and what most people think about when you talk about sickle cell disease. But there are other variants. So SS is the most common. The next most common is SC. And then you also have the sickle beta thalassemia, sickle beta 0, sickle beta plus. So there are four main genotypes: SS, which is the most common, SC, which is the next most common, and then you also have sickle beta 0 thalassemia, sickle beta plus thalassemia. Now, in addition to these, there are other rarer variants Maxime and I newly discovered another new variant that we published a couple months ago. So there are different variants. We have the four most common. Most people think mostly about SS, but it's important to know that there are also different variants of sickle cell disease. There are different types of sickle cell.
Okay, thank you for that explanation, Mark.
Mhm.
It really helps us paint a picture to it. Yeah, so following up on what you said, you mentioned that it's genetic,
Yes.
the genetics, yeah, so that means that there's nothing, so how do individuals play a causative factor, or do individuals play a role in the child, or in a child being born with sickle cell, or is it just up to genetics and chance, or are there steps that individuals can take to prevent this? That's what.
Sure, there are steps to take to prevent it. So, because it's in the gene, it's important to know what your genotype is, because the genotype of the mother and the father determines the chance of sickle cell disease in the child. So, for example, if you have two people who have sickle cell traits, now sickle cell trait is AS. So, if you have two individuals that have sickle cell traits, with each pregnancy, there will be a 25% chance of having a child who is SS, a 25% chance of having a child who is AA, who is completely normal, and a 50% chance of having a child with sickle cell trait AS. So this is with each pregnancy. So if you have two people who are AS and they have one child who is SS, it doesn't mean, oh, I've met my 25% chance, my 1 out of 4, and I've met my quota. No. You can have another child with SS with the next pregnancy because the chances are with each pregnancy. So it's very important to know that. And also talking about the different genotypes. We said there's also SC. So if one individual has sickle cell trait AS, another one has the C trait AC, they can have a child with SC. So when you do the genotype, it's not only important to find the people to take note of the people who have sickle cell trait. People could have other traits like the C trait, the beta thalassemia trait, that could combine with the sickle cell trait to give a form of sickle cell disease. So it's very important, and that's why we have to realize that sickle cell disease is not only SS, there are different kinds.
Okay, thank you for that, Mark. Thank you for also picking on something you said. You said so usually it comes to this whole sickle cell is because the red blood cells are sickle shaped or moon shaped. So usually during periods of maybe accession and maybe a part of the body needs more blood, they're all trying to squeeze into the blood vessels, and because they are not as elastic as the normal blood cells, they cannot fit. And then so is it only during periods of accession that sickle cell individuals feel symptoms, or what I'm asking is how are their symptoms, or what are the signs and symptoms they present, and is it only during periods of accession that they present the symptoms?
That's a very good question. So it's not only during period of accession. So for example, the normal red blood cell in the person who has a normal genotype AA can last for up to 120 days. In sickle cell, it's like 10 to 15, 10 to 20 days, a lot less. So you can imagine the turnover in the patient with sickle cell. That's why their blood count is always low. Because instead of those red blood cells lasting 120 days, they're lasting 10 days. So every 10 days, they have to rebuild their red blood cells. So that's why they're anemic at baseline. Their blood cell count is low at baseline. Now, there are different symptoms you can have with sickle cell. If you imagine that this is a disease of the blood, and you have blood running through all your tissues and organs. So every tissue or organ can be affected. You go from the head to toe, you're going to find something that's affected. Now, the most common manifestation, the most common symptom of sickle cell disease is what we call the pain crisis or the vaso-occlusive crisis. This is the number one reason that people with sickle cell seek medical attention. And it manifests as like severe pain, and usually they have to go to the hospital to get that treated. And this is still because of that plugging up of the small blood vessels and starving the tissues. When your tissues and organs are starved of oxygen, they can start to, die or malfunction. And this causes pain. Pain is your body's way of telling you, oh, there's something going on. I'm not doing so well. And so the pain crisis or vaso-occlusive crisis is the number one symptom in sickle cell disease. You could have other symptoms. There's something called acute chest syndrome. Now, this is a very serious syndrome that consists of an abnormal change on the chest x-ray, and respiratory symptoms like low oxygen, wheezing, coughing, chest pain. And this is actually the #1 cause of death in sickle cell disease in both adults and kids. It has to be treated by blood transfusion. It's important to recognize this early. So that's another big major complication. You could also have complications of acute anemia. So sickle cell patients have anemia at baseline, but they could have things that cause them to cause a big drop, further drop in their baseline blood level, their baseline hemoglobin. That's another complication. Some people with sickle cell have leg ulcers. That's open sores, usually around the ankles. This can take years to heal sometimes. This is from the sickle cell disease. People can also have what we call avascular necrosis or osteonecrosis, usually happens in the hip. And this just means that the bone of the hip is starting to die off. So if you look at the chest x-ray, you can tell that the bone is starting to die off. And this usually leads, when it gets very severe, people have to have hip replacement to take care of this, because the bone has just died off so badly that it cannot be just left alone like that. You also have people who can have strokes from sickle cell disease. And sometimes people recover fully from the strokes. Sometimes they don't recover fully from the strokes. You can have sickle cell affecting the eye. It's called sickle cell retinopathy. And you have to treat that promptly. Otherwise, that could lead to blindness. You can have dysfunction with the spleen, which is an immune organ, with the liver. You can have kidney injury. So there's so many complications. And that is why with sickle cell, prevention of these complications is key. We want to prevent these things from happening rather than having to deal with them after they already happen.
Okay, thank you for that, Mark. Thank you for that answer. So my next question would be, so for those that don't have the opportunity to deal with them, there's people that are already born with it. It's obviously out of their control. And we know that there is this stigma and societal isolation they face. Oh, this person is SS, or this person is SS, or don't do this to them, or don't play with him, he's SS, he can just fall, or don't do this to them. So usually they end up stigmatized, and they already have SS, then they start thinking, in some cases, they start thinking that depression sets in, and it's just a whole negative loop sort of thing. So how do we manage the social isolation or the social stigma associated or stereotype with the sickle cell disease?
Yes, stigma is a big issue. And if anybody has heard me talking about sickle cell disease, they hear me say education is key. We have to keep educating. We're educating not only the patients and their families, we're educating providers, we're educating the community, because you have to keep talking about sickle cell disease to normalize it. There's nothing to have a stigma about in sickle cell disease, just like other chronic diseases, there shouldn't be stigma attached to it. But just because of the history of sickle cell, we still find that there's stigma. So only by continuing to talk about it, like avenues like this, educating the community that, oh no, sickle cell is not a communicable disease. You're not going to get sickle cell from playing with somebody with sickle cell or from eating with somebody with sickle cell. We need to keep educating the community to dispel those myths that bring that stigma around, and also to keep advocating for our patients. A lot of sickle cell patients, when they go to the emergency room, they don't get good treatment because they label them drug seekers already. So not every sickle cell patient is a drug seeker. It's actually just a very small fraction, just like the general population that are drug seeking. And so that's where we have to educate the providers. Okay, don't look at the people with sickle cell as drug seeking people. Do not call them sicklers. Sicklers is considered a derogatory term. You call them people living with sickle cell disease. So, so just education is going to be what our tool to help take away this stigma.
Oh, okay. So really, if we help to raise awareness and educate people more, it would deal with the stigma.
Yes, and September is Sickle Cell Awareness Month.
Okay. How timely! How timely! Okay, next question, as I mentioned, some people already have these things. They already have sickle cell. I don't want to sound derogatory. So moving on, what are the necessary steps to effectively manage their condition?
Yes. So when we talk about the #1 manifestation, which is pain crisis, so there are triggers that can put people into a pain crisis. So if people know their triggers, it could be extremes of temperature. If somebody is sick, it could trigger a crisis. There are different things that could trigger a crisis. So people also, if you're not well hydrated, that could trigger a crisis as well. So people know to avoid their triggers. Okay, so if you know that the cold weather will trigger a crisis, try to bundle up when it's cold. So that's the number one thing for the crisis. Know your triggers and avoid your triggers. And then when it comes to general management, blood transfusion is something that has been used from time immemorial for sickle cell disease. It helps to provide the good red blood cell to help carry oxygen to the tissues. It helps to dilute out that abnormal sickle hemoglobin, those abnormal red blood cells, and help the tissues and organs get better oxygenation. And then there are currently 4 FDA-approved medications to treat sickle cell disease. The first one is hydroxyurea. It's a tablet. It's an oral medication that can be taken. And it was approved because studies showed that hydroxyurea can help decrease the pain crisis, decrease the acute chest that we talked about. And even some studies show a mortality benefit, meaning that these people with sickle cell patients can live longer if they're on this medicine. Now, hydroxyurea works by increasing what we call the fetal hemoglobin, which is the hemoglobin that you mostly have in the babies when they're in the belly or when they're newly born. And this fetal hemoglobin helps to hold on better to oxygen. So hydroxyurea increases this fetal hemoglobin and helps the patient hold on better to oxygen. So that's a medicine that can be used. Another medicine that was FDA approved, the next medication is called L-glutamine, an amino acid. The brand name is Endari, and this is a medicine that's taken twice a day. You mix it in water and you drink it twice a day. And it was approved because the studies show that it could decrease the frequency of pain crises, decrease the incidence of pain crisis. And that was approved in 2017. And in 2019, the last 2 new medications were approved. The first one was crizanlizumab. It's what is called a monoclonal antibody. The brand name is Afya, and it was also approved because the studies show that it decreased pain crisis. And so this one is an intravenous medication. It's IV medication, not oral. It's given through the IV once a month. And the last of the 4 medications that was approved in 2019 is voxelotor, or the brand name Oxbryta. And this is an oral pill, and it was approved because the studies show that it improved the hemoglobin of people with sickle cell disease. So people with sickle cell disease who took it had a higher hemoglobin and also less hemolysis, less breaking down of the red blood cells. These are the 4 currently FDA-approved medicines. And in addition to that, blood transfusion has always been around to help, treat and manage sickle cell disease.
Okay. Yeah. Thank you for that, Master. From what you said, we have like 4 approved medications all the way from 2019, and blood transfusion for as far as we can remember.
Yes.
Yeah, so, looking forward, what potential advancements or what are there research proven tips, or are there research proven things that are looking like silver linings that can come in the future? Are there techniques that are being worked on to improve the medication?
Oh, yes. So there's a lot in the pipeline, and the sickle cell community is very happy now because if you look back 10 years ago, 15 years ago, we didn't have as much research as we have now into sickle cell disease. It took a while, but we're getting there eventually, and the research is really ramping up over the past few years. And so the research into different medicines that can either help improve the hemoglobin or decrease pain crisis or decrease end organ damage, the effect of sickle cell on the heart, on the lungs. There are lots of medications in the pipeline in that area. And also, as a curative procedure, currently, bone marrow transplant is the only proven cure for sickle cell disease, where you have a donor and then they give you the marrow and then your body starts to make more normal hemoglobin. But in addition to that, in clinical trials now is gene therapy, because sickle cell is a genetic disease. And so you think if you could change something in the gene, then maybe that could be a cure. There have been anecdotes of patients who have had gene therapy and are doing well. But with every clinical trial, we have to wait till the end of the trial to really see the percentage of population of the people that it worked in. And so we have lots of drugs in the pipeline to help manage sickle cell, and we have another curative modality also in clinical trials, which is the gene therapy.
Okay, thank you for that. It looks like there's a lot to look forward to.
Yes. Interesting times to be in the sickle cell world.
Okay, well, okay. So my next question will be, based on what you've touched when you mentioned management, prevention, it's all been medications, avoiding your triggers, uh, other forms of therapy and medication. But like in some other diseases, there are things that they're like lifestyle changes that the individuals can take, like maybe exercising, changing the diet, and stuff and things like that. In the case of sickle cell, would doing things like that improve the person's condition, like exercising, regular exercising, and diet, changing your diet, stopping smoking, things like that? Would it have a positive effect on managing the condition?
Oh, yes. I tell my patients that if you take care of your body in sickle cell, it's going to show. So it's going to you
Okay.
improvement. So yes, maintaining healthy lifestyle habits, regular exercising. So everybody with sickle cell knows their limitations. So don't over push yourself. Your body will tell you when it's too much. So regular exercising, eating healthy, staying away from like illicit drug use, smoking,
Okay.
which can affect the lungs. All those do play a role as well to keep you in the best health of
Okay.
sickle cell disease. Mhm.
Okay. Okay. Thank you for that. So I feel like the individuals also have a role to play in managing the condition as
Big
well.
role.
That's why I wanted to drug because I was looking
Yeah.
like everything is drug,
Oh
and
no, no. The individuals play a very big role. A very big role.
okay,
Yeah.
okay.
Because
Thank you for
nobody knows them better than themselves. So
yes, true. I agree. I agree. And as you said, when you're because of the whole exertion thing, when you're exercising, you know your limits.
exactly.
So don't
Exactly.
go
Don't go the
overdoing.
first day I start lifting 100 kilo weight. No. Start slowly and gradually.
Okay, okay. Before we the opposite of what we're trying to avoid comes in.
Exactly. Exactly.
Mhm.
Too much of everything is not
Yeah.
good.
Okay, thank you very much. Like, this has been very informative, and I could go on and on asking questions, but time and all that. So, would you wrapping up? Like, can you give us a brief or a take-home message for the audience on sickle cell? Something they should engrave in their heart. Let's say engrave in their hearts, not to be too
Yes.
dramatic, but something they can take home with, like a summary.
Yes. And so I'm talking both to the sickle cell community, the patients, and the community. So I have three take home points. Number one is
Okay.
sickle cell is not a death sentence. So the average life expectancy, they say, is in the mid 40s, but we have people living well into old age. My oldest patient is 77 years old. And so, with adequate care and really good management, we can get people with sickle cell to live long, productive lives. So it's not a death sentence. Doesn't mean that you have sickle cell, forget about it. No. If we all do play our parts, the patients, the providers, the community, we can get people with sickle cell disease to live long and productive lives. Number two, like I mentioned before, education is key. Education, 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 educating the patients and the families, educating the community, educating the medical providers, because not everybody is knowledgeable enough to take care of this patient. So education goes a long way. Wherever you can lend your voice for sickle cell disease, please do so. If they're having a forum, with the legislators, with the community, please go and lend your voice. There's no better person to represent themselves or to advocate themselves than the sickle cell patient themselves. So please always lend your voice, be an advocate for yourself and for the sickle cell community. And the third thing I will point to is that research is important. So I tell people,
Okay.
just like diabetes, just like high blood pressure, just like HIV, they had to conduct research to figure out, okay, these are the three drugs that will work best together. The same thing is going to be with sickle cell disease. So please, whenever you're opportune to, please participate in research. Only with research will we be able to really advance the field in sickle cell. and make sickle cell just more like a chronic disease like HIV or diabetes. We
Okay.
have to participate in research to get to that point. So I implore all the patients, whenever you can, please participate in research. This is going to help us help the sickle cell community, both currently and the future community of people with sickle cell disease.
Oh, all right, all right. Thank you very much for that, ma. So
You
before we, there's one question that skipped my mind. So
sure.
just this, like an advice for people that might want to take the gamble. You know, you already said that. So say someone that has the two people come together, they both
Yes.
have the sickle cell traits, that's
Mhm.
the AS and AS, and then they sort of have this belief that okay, let's say there's 50% chance that there's like 75% chance that it's either A or AS. That's cumulatively, and
Correct.
they want to take the chance and pray to God and hope that and hope that it's just going to be A and AS, and eventually, and sometimes in cases like that, they might have SS kids. What advice do you have to people that might be thinking of throwing that part of taking the chance, gambling?
Yes, so if you have two people who, for example, have sickle cell trait, that's a
Hmm?
25% chance of having a child with SS, a 75% chance of having a child who does not have SS. But I would say even that 25% chance is too much a risk or a gamble to take. However, our jobs as physicians, as providers, is to arm the patient with information, to give them all the information they need to make an informed decision. So we provide them all the information because they will ultimately make the decision. But
Yeah,
to me,
so,
my personal take on it is that even a 25% chance is too high a risk to take when with sickle
okay.
cell disease, given all the complications that could occur with sickle cell.
Oh, all right, all right. Thank you very much, Ma.
You're
Thank
welcome.
you much. So we've gotten to the end of the day's episode. And on behalf of the management of the Agbari Multimedia, I want to say thank you, Dr. Ugochi, for your time and lending us your expertise. I understand that usually, because of your experience, people usually pay to hear you say this, and you're just here, just here giving us all of this for free. Thank you very much for obliging our
You are
invite.
most welcome. Always my pleasure to educate about sickle cell disease.
Thank you for that. So, and to the Agbari Multimedia family out there, thank you for watching. Don't forget to like, subscribe, and share the video with your loved ones. As I always say, you don't know whose life you might be saving with this information. Also, in the meantime, you can follow us on our social media channels and platforms on Instagram and on Facebook at Agbari Multimedia. Till we see again next time, my name is Kede Shitu. Bye.